All right, welcome everyone to our weekly Native Town Hall, Native Strong. Just kind of going over topics related to the COVID-19 pandemic and how they are affecting the Native community and also the Milwaukee area. Once again, we have, of course, our featured speaker, Dr. Lyle Ignace, along with our moderator, Mark Denning. For those of you who joined us last week on our initial run, as we move along here, and I'm sure questions will pop up, please enter them into the chat box, and we will go through those and get to as many of them as we can as part of our Q&A session after Dr. Lyle Ignace's presentation is completed. And with that, I'll introduce Mark Denning. Mark, thank you.
Winnabuju and Maganuduke, Nadwe Nazi Indigenous Namain Dodem on Schnabe, Hominomaneak. Lenape, Delaware, Mohikanak, Ndow, Neopit, and Donjaba. Good afternoon, relatives. It's good to see you all out there. Mark Denning with Dr. Lyle Ignace. And we just had our opening, and thank you very much for the introduction. Jeremiah, if for the people who might be new to Zoom and unfamiliar, Jeremiah, could you walk through just a bit of housekeeping on how Zoom works as some of the folks are looking at their screens, should they have tuned in just now, to get into the chat window and so on? How is it that they do that?
Sure thing, Mark. So on your typical screen on your interface, towards the bottom of your screen, if you kind of drag your cursor, a bunch of icons should pop up, and somewhere right in the middle, there should be a chat bubble that pops up. If you click on that, you will get another box or sidebar type thing on your screen, which within that you'll be able to type in, like I said, questions or comments as we kind of move through here. And as we get closer to the end, Mark and myself will kind of sift through those and, like I said, try to answer as many of them as possible. I do currently have it set up so I think all the attendees will be on mute during the presentation, just to kind of try and move this along. And like I said, if you have questions or would like to speak up and add your point of view, please enter that into the chat box located towards the bottom of your screen.
So for all of you that are attending, and for folks that certainly check in after these are broadcast, which is quite often the case because there are so many things trying to get our attention, Dr. Lyle Ignace and the Ignace Health Center, Indian Health Center in Milwaukee, this is where we get to have a doctor visiting our homes. It's a native to native conversation. Dr. Lyle Ignace tries to keep the information local to our area and nationwide information where it helps the conversation. We're encouraging each of you, especially here in the state of Wisconsin, a lot of us, and for those new kind of maybe the second, third shifters just getting up for their workday, the state Supreme Court here in Wisconsin ruled that the state's governors stay safe at home orders, those policies were illegal and they have been lifted for our state. And a lot of my relatives, a lot of folks out there have been called back to work. There's lots of questions around what that looks like, what requirements are expected of them and their employer. And while we don't have all of those answers, we do have answers that can help you be safer. And we have some answers that can help your family and loved ones be safer. So I'm going to turn this over to Dr. Lyle. He has a presentation for us and some opening words. And thank you everyone for attending. Dr. Ignace.
Thank you, Mark. Thank you, Jeremiah, and welcome back to our series of Native Strong Town Hall discussions. Feel free to chat in questions at any time, and we'll certainly scroll through them as we go. So my name is Lyle Ignace. I'm an internal medicine doctor by background. I'm Coeur d'Alene, my father's side from Idaho and Menominee. My mom's from Wisconsin. I am the CEO of the Gerald L. Ignace Indian Health Center, and I am pleased to be able to talk to you this afternoon. So I'd like to just kind of preference this by saying that the COVID-19 experience. It is extremely fluid. Information changes, policies changes, legislation changes almost on a daily basis. So I'm trying to get all this information together and being able to present on information as of the latest. So, I'd like to talk about native health as the primary focus, and certainly as it results and impacts us in our own communities. So, just a quick oversight as to where we are. Worldwide, there's been 4.3 million cases, almost 1.5 million recovered cases worldwide, resulting in almost 300,000 deaths. Here in the United States, there's been 1.4 million cases. We certainly have done our testing and approaching 10 million tests to date. And the number of fatalities has been 84,000. Here in Wisconsin, we've quickly approaching 11,000. Nearly half, a little over half of the cases since mid-March have recovered, 5,600, with 421 deaths related. This is a map that kind of outlines every county throughout the country. And the red spots are the designated areas that have had the most cases in the counties of the state. So you can see quite a wide distribution of cases have been ongoing, especially on the East Coast, from Boston down to Baltimore, Maryland, down in the South, in Florida, along the Gulf Coast, and certainly in the Southwest, and obviously in Seattle, where we've had the first major outbreak and first major case reported out early on in this pandemic. So the number of cases in Indian country, the best source that I've found is the Indian Health Service. Now, the Indian Health Service reports out on their federal sites, their tribal sites, as well as their urban Indian health programs like ourselves. IHS sites, the federal sites, are mandated to report. Tribal sites are not. And urban sites are not obligated, but this center provides those testing results to our respective area, just to make this as up to date as possible. So in this graph, you could see on the left-hand side, IHS and the regions, the areas. There are 12 areas. And just quickly browsing through, looking at the number of tests that are done, the number of cases, positive cases, and the negative cases. This was as of May 11th, midnight. And if you just scroll down and look at this, you can obviously see there are a couple areas that are of significance. One is Albuquerque, 369 cases, Phoenix, 637, and obviously Navajo, with almost 3,600 cases. And what I did for this, at least for this discussion, is on the right-hand side of that table. You see on top where it says change plus and the number tests. Those two columns, so what I did was compare last week's test that I reported to this test. So this is a week change in positives and the number of tests that were done over that time period. So as you go down the column from Alaska down to Tucson, you could see how many new cases in 7 days have occurred. And obviously the one that highlights the most is Navajo, followed by Phoenix and Albuquerque. So it's important to trend this rather than look at things on a daily basis, although it's kind of hard not to. But when you start looking at the numbers over time, you get a better sense of what's going on. So in the second, on the far right side are the percent change and the percent positive. So in a week's time, the percent change, you can get a better understanding of what's going on in the areas. So you see in Billings, there was a 64% change. In the Great Plains, a 53%. Nashville's almost 50%. Phoenix, 56%. So these are pretty significant. And when you start looking at different areas, you can see just pure numbers, who has the most numbers, but what's going on, what's been going on over the last week. And so you can start trending out is who's hot, what areas are hot, and which are areas are kind of cooled off. So the areas I mentioned, so Billings, the Great Plains, Nashville, and Phoenix. Certainly Navajo certainly has its numbers of cases, but when it looks at the percent change from where it was a week ago till now, that's significant. That would be definitely areas that if you have relatives, family members that reside or from that area, those may be the next potential hotspots for Indian country. The percent positive is the number of confirmed cases over the total number of cases tested. So as you scroll down, you can see you have very low numbers, and then you have some significant numbers like Nashville, almost 11%, Navajo, 14%, and Phoenix almost at 16%. So that doesn't, just looking at the number, that doesn't mean a whole lot, but it does when you relate it to the number of cases to the number that are actually being done for that area. So when we look at this collectively, so areas like Nashville, they've had 100 new cases since a week ago. The percent change is 50%, and the number of tests being done resulting at 11%. Putting those together, I would be on a more heightened alert and a sense of urgency in the Nashville area. It goes without saying, Navajo as well, and also Phoenix as well. So these are not just hotspots, they will continue to be hotspots, and I would be concerned about the Billings area as well. Just giving an overarching view of where we are, Wisconsin, as it relates to the other states. Early on, Michigan certainly had a lot of cases. They have flattened out, and they're residing in about 48,000. Just south, Indiana, 25,000. Illinois, almost 85,000. Minnesota, almost 13,000, and we're almost at 11,000. So 3 weeks ago, Minnesota had very few numbers. They have skyrocketed, and they are surging right now in the entire state. And so they're going to continue to increase in the number of cases, and they will far exceed us. That didn't look like to be the case 3 weeks ago, but they certainly have increased their numbers now. These next couple of slides are more specific to Wisconsin, Minnesota, and here Michigan. And what I'm showing here are the tribes county. Now, what I don't know is in Lakeview, for example, they have 4 cases in that county. I couldn't tell you if all 4 of those cases are tribal members. It's quite possible they are, although I couldn't tell you with absolute. Same with Bay Mills or Little Traverse. It's certainly possible that each one of those reported cases are from Little Traverse, but I couldn't tell you for certain. But there's probably a high probability that it is. Down in the southwest portion of the state, you see in Kalamazoo, there's 636 cases. Compared to a week ago, there have been 77 new cases reported in that county alone. So it's quite possible, you know, a good portion of those may be tribal related, although I can't confirm it. The only thing that the Michigan does report on is the overall rate. And right now, given Michigan's total population, native population of 60,000, they report out less than 1% of their cases are native. They don't have an absolute number. So that is probably the best anyone could do right now, given it's early on. The data will need to get a little more granular, but right now, the total native cases in the state of Michigan is less than 1% of the total population. Minnesota, like I mentioned, they are surging. Their cases are increasing. You know, the northern portion of the state, like Fond du Lac, Leech Lake, these are tribes that reside over a couple counties. So their numbers, Fond du Lac of 164. So between yesterday and a week ago, when I first reported this out, they've gained 109 cases. So it's quite possible their tribal health system, their tribal clinic is increasing their capacity to test folks and confirming cases. I have not gotten any official numbers from Fond du Lac, but that's what is being reported for their state by the Minnesota Health Department. You can see other counties, Shakopee, their numbers increased by 77 from last week. Mill Lake, their numbers increased by 18. So when you start delineating all these numbers, you really try to make your best estimates. Now, the one good thing about Minnesota's Department of Public Health website is they do give an absolute number. So their absolute number is 94. So if you look on the far right column where it says cases, that certainly combined adds up more than 94. And so as of right now, we do know that there's 94 cases, and that we don't know of what portion of what tribe those numbers are associated with. So 94 cases as of last night. When we look at Wisconsin, our home state, you can certainly see the tribe and the county affiliation. You know, Oneida, they overlap Outagamie and Brown County. There's over 2,000 cases. Between 1 week ago and today, they've increased by 520. We know that that is not all native cases, because I mean, we all have friends, folks, and family who are from Oneida, and they certainly aren't reporting that many numbers. But so you can see how difficult it is to account for every case known. Now, our Wisconsin DHS, Department of Health, has reported out 128 cases in the state. So as you go through each county and each reservation, you can get a sense of where these cases actually may reside. So 128 cases as of yesterday, you know, certainly is significant for us, and it's going to be important in how we move forward and how we mitigate all new cases moving forward. This is the Wisconsin's DHS reported cases, 128, which is 1% of the total cases in the state, 5 related deaths associated. As you go down the left column, you could see the other races, Asian, Black, White, and these 2 other categories of multiple or other races or unknown. My concern, at least in the state of Wisconsin, is that these, there could very well be more natives that are reporting out more than one race. And so it's certainly possible this high number, over 1,000, there are other natives in this group that just haven't been able to delineate how many in that group. So, but they're there without a doubt. Giving a quick overview of the entire state. This on the left-hand side is Wisconsin. And believe it or not, between midnight last night and about 1 hour ago, I write out here 68 of the 72 Wisconsin counties have been reported as being positive. As of in the last hour, 2 more counties have reported positive cases, and that is Pepin County and Burnett County. So now there are only 2 counties left in the state that have not reported any cases. Overall, almost 11,000 cases. We've tested almost 120,000. Milwaukee has the highest number of 4,200. That's an increase of almost 1,000 cases between now and a week ago. Brown County, almost 2,000. Dane County, 445. They've remained kind of steady incremental increases. The 2 counties that are increasing on a steady pace is Kenosha and Racine County. Those are the further south ones bordering Illinois and Chicago area. And obviously in the state of Illinois, just to give some context here, 66,000 cases. They've tested 3 times as many as we have. McHenry and Lake County, these are the 2 counties that are the northern aspect just below Kenosha. They obviously have a fair amount of cases as well. And then Cook County and Chicago proper, their municipality is continues to accelerate on a daily basis. So tremendous amount of cases in Illinois, right across the border into Wisconsin. So very concerning. Bringing it back home here to Milwaukee. Milwaukee has reported out over 4,300 cases, 227 deaths related. The number of cases newly diagnosed as of yesterday approached almost 100 cases. And this on the left-hand side, on the left, in the middle, confirmed case count by age group. So you can see the age distribution here. There are young people who can get the virus. Age groups in the 10s and the 20 age groups certainly get cases, but right in the middle, and this is the age group of 30, 40, and 50. That is the bulk of the cases here in Milwaukee. And so 30, 40, and 50-year-olds obviously have the greatest proportion of cases. And then obviously we know about the older age groups as well and the number of cases. So in the center is the 7-day kind of caseload total of cases. And you can see on the northern aspect, the yellow circles certainly indicates the number of cases, newly confirmed cases. And so the bigger the circle, the more cases. And for folks, Native folks who live on the south side, you can see the diameter of the yellow circles are bigger, and they're more clumped together. And so in the beginning of this pandemic, there were certainly a lot more cases on the north side. That seems to have kind of peaked and plateaued now, and now it's the south side. So the density of cases are now being diagnosed and being tested on the south side, and the numbers certainly reflect that as well. So what was occurring on the north side at first is now occurring on the south side. So if you reside in these areas, certainly think of these as being high risk areas to yourself. The breakdown here in Milwaukee, American Indians and Alaskan Natives, the percent of the cases is 0.4. And as of last night, if you look on the right-hand side, second column from the far right, there you see a number 13. That is us. So compared to other races and ethnicities here in Milwaukee, we certainly pale in comparison to the other, which is it's important to keep things in perspective. 13, well, we know there is about 15,000 natives that reside in the greater Milwaukee area. 13 is a very low number, and we want to make sure we keep it there. I know last week we talked about who's at risk. It's important to know who is. We know based on numbers and individuals that are at high risk are people over the age of 65, our loved ones who live in nursing homes or long-term care facilities, certainly people with underlying chronic care conditions such as COPD, asthma, any kind of restrictive lung disease, anybody with any serious heart conditions. So that includes people who've had prior heart attacks, high blood pressure, heart failure, individuals with can you see my screen?
Cannot, it's a blank here.
No, you
The
went dark.
screen is blank here.
Went dark. Maybe Jeremiah, if you want to, do I have to share my screen, or do you want to take over the PowerPoint? I'm not sure what
Yep,
happened.
just pulling up the where we are here.
Okay. Good moment to take a drink. All right. All right. Yep, that slide right there. So high-risk individuals, people with diabetes, kidney problems, liver problems, people who are undergoing treatment for ongoing cancers. Here you go out again.
That's a little weird.
I can just speak through it if you'd like.
Yeah, go for it. I can't. I don't know if that's an issue with the PowerPoint itself, because
Sure. Let me. There you go. Technical difficulties. We're back on. Game on. Game on.
Apologies.
No problem. So we're talking about high-risk individuals, people who have been treated for cancer either by chemotherapy. It's okay. I'll speak through it. Bone marrow transplants, even individuals with HIV or AIDS that are poorly controlled. People who have chronic corticosteroids for or medications that treat autoimmune diseases like rheumatoid arthritis or lupus. These would be conditions that may weaken your immune system and make you place you at risk for contracting the virus. So one of the main things that you could do to help prevent and protect yourself is washing your hands, and washing your hands for 20 seconds. Soap and water. It doesn't matter as you know, warm water, cold water, doesn't matter as long as you're washing for 20 seconds. The next best thing you could do if you have it is hand sanitizer. And on the bottle, it needs to say ethyl alcohol greater than 60%. That is the kind of the ratio that is best needed to inactivate the virus. And probably the biggest thing that anybody could do is avoid, and I know this is hard, but avoid touching your eyes, nose, and mouth. Your hands unprotected in the community, in the general public, anywhere you may go, whether that may be the library or to the grocery store, anywhere in public. If you use your bare hands, the quickest and easiest way for the virus to get introduced to you is directly through the eyes, nose, or mouth. So avoid touching directly, and I'm talking about rubbing or picking your nose or sticking your finger in your mouth. That is the sure way to place a direct entry of this virus into your system. So, next slide. So individuals who may get sick, it's important to stay home. But if you do get sick, your loved one or a family member that reside in the house, you also need to look at those individuals as being quarantined and isolate themselves. So it's important that they have a dedicated room, a dedicated bathroom, dedicated household items, dishes, towels, bedding. If you have a face mask, it would be best if they were to wear the face mask. So the face mask protects the family from direct exposure and prevents the sick individual from spreading the virus. What you do in the general public should also be a rule that you should be doing at home. So that washing your hands. Just because you get home, you feel like you're safe, everything's good, you still need to wash your hands, even in your own house. If you don't have soap, please use your hand sanitizer. When it comes to cleaning services, you need to be very diligent about surfaces. So your laptops, your cell phones, your doorknobs, your countertops, your cabinets, your cooking service areas, your kitchen table, your door handles, everywhere there's a hard surface, those need to be cleaned and disinfected on a regular basis. Next slide. So it's important to use a disinfectant for sanitizing. And bleach is the most common household item. You can dilute it. I've included 2 recipes on how you could do that easily. 5 tablespoons of bleach per gallon of water, or you can use 4 teaspoons of bleach per quart of water. I know sometimes people have these these spray bottles. That's about a quart. So if you use 4 teaspoons, fill it up, that would be 1 quart. That would be a good way to do a quick and easy and use that spray bottle over your surfaces and wipe down. Next slide. So the EPA has products, Clorox, multi-surface cleaner with bleach, Purell, Lysol disinfectant. These are pretty common household items and have been shown to be effective in destroying the virus. However, I will say with a caveat, if you're going to use bleach, you still need to, after you use it, you need to give some time to let it dry, and don't touch the surfaces for at least 10 minutes. After 10 minutes, you consider it a clean and a disinfected area. Next slide. So I kind of joked about this last week, about some myth busters. I know there, certain, people had questions last week that kind of got into this, but I just want to kind of quickly go over maybe some commonly thought notions here and quickly discuss those. So first, do cats and dogs spread the virus? Now, for people that have pets, animal lovers, now I know it's all over Facebook, and there's been reports of the Bronx Zoo. I think it was those Bengal tigers and lions from the Bronx Zoo that came up positive for the virus. Now, what they found out was the animals contracted the virus from an asymptomatic keeper, believe it or not. So it was the human to animal transmission that occurred in those cases. They've also reported 2 other cases in the U.S., 2 cats who contracted the virus. These cats were of different households. They were not in the same. And both of those instances occurred because of their owners turning up positive. So it is a human to pet. However, that it's pretty safe to say that it's unlikely to occur, but there have been these anecdotal cases of human to pets cases. What has not been shown are cats and dogs and animal to human transmission. So human to pet, human to human, not animal to pet transmission. So in terms of cats and dogs, no, there has been no proven case that cats and dogs can give you the virus. Wearing a mask provides 100% protection. Well, nothing will give you 100% protection unless you wear a hazmat suit from head to toe and you don't come out of it. That would be pretty close to being 100%. Wearing a mask. Now, the general sense right now, the recommendations based on guidance and recommendation by the CDC, is the intended use for the mask is for the individuals who are sick. It is recommended that they wear the mask to prevent the transmission. Now, it's not 100%. The masks, the coverings that you see people wear, they're cloth, and it's not, virus can get through the cloths. Even the procedural surgical masks, they're not 100% either. But they do provide a very good level of protection. You hear about N95s. Well, N95, the 95 part comes from basically, it will help protect you from 95% of the exposure. Now, you also have to remember that masks are not, they're not built to last for long periods of time. So things like the surgical mask, they're really only good for 4 to 5 hours, and then they break down. Chemically, they break down, they get moisture on them, and they just don't keep their fidelity. So you need to exchange one for a new one. So as you wear one, over time, it breaks down and it becomes less and less effective. So wearing a mask provides 100% protection. Answers no, it doesn't, but it's better than nothing. It does give you a high level of protection, but not 100%. Spraying alcohol or chlorine on your skin kills the virus. Now, I did mention the ethyl alcohol as being the concentrate of hand sanitizer. Yes, that type of product will destroy or inactivate the virus. Pure alcohol liquor does not. It does not have the alcohol proof in it to actually be destructive. So that part is no. Chlorine. So I'm sure people have heard chlorine. People have drank mixtures of it, off the shelf stuff. This is a sure way to harm yourself, your mouth, your GI tract down to your stomach. Not recommended at all. And direct chlorine exposure is a lot more harmful, even on the skin, than using the other soap and water and the hand sanitizer. Hand dryers, blow dryers kill the virus. I had to look this one up a bit, and the information out there is pretty scant. There's no evidence that it does. And the discussion about exposure to light, UV lights, and heat and humidity, that keeps coming up. But in this case, the direct exposure to heat has to get pretty high. High enough that if you were to do it, expose your skin for a long period of time, it actually would cause harm, and the temperature would have to be higher. So the temp has to be extremely hot, and hand and blow dryers would, exposure-wise, would cause more harm than being useful. So I wouldn't recommend it because it would cause harm to your skin. You have to be with someone for 10 minutes or more to catch the virus. Now, it's a little bit of play on words in this statement, and it's true. Being in the vicinity of someone who has the COVID virus, there is a chance that you would contract the virus, but it certainly doesn't take 10 minutes to do it. It could take 2 seconds, especially if someone with the virus coughs or sneezes directly at you or on you. You can certainly transmit that virus fairly quickly in that regard. So it does not take 10 minutes to do that. Gargling bleach is a preventative method for catching the virus. Yeah, bleach is pretty toxic, and this is something I do not recommend. Don't even contemplate, because it will, any exposure directly to bleach on the mucosal membranes, your mouth, nose, eyes, is very corrosive and can cause injury, and pretty bad injury, very quickly. So I don't recommend this, and very bad idea. The last one, you can catch COVID from eating Chinese food. Answer is no, you can't. And the reason is not because it's Chinese food. It can be any kind of food. It doesn't matter. What does matter is the containers that the food comes in. So you have to make a lot of assumptions that for the food that you may call, you know, you and your family don't want to cook that night, you want to call P.F. Chang's or the local Italian restaurant and order some pizza, and they come in containers. It's not the food that you should be worried about. Enjoy that, eat it. It's the containers that it comes in. So on that delivery, it's the containers that need to be cleaned, kind of disinfected, wiped down, and after several minutes, it would be safe to handle and dish out, and then discarded, and then wash your hands. So eat any kind of takeout you want, any type of food you want. It's the containers that it comes in that you have to be worried about. So I know people probably know these already, but again, it's always worthwhile going through these and debunking kind of these myths about how people can get it. I've seen it on Facebook, so it's always important to remind folks. Next slide. Just so folks have an idea of our clinic, the Gerald L. Ignace Indian Health Center, we offer a lot of programs. Given this time, people are at home, and you know they're maybe out of work right now. They may be furloughed, trying to make ends meet. Very difficult. You may have multi-generational families under the same roof, and having the means just to meet the basic requirements that your family needs. We can offer some of that. So we can offer family kits, games for kids. We provide personal hygiene kits as well as cleaning kits. These cleaning kits include detergent, includes bleach, soap, bars of soap, as well as hand soap. You know, we can provide basic toiletries, toothbrushes, hairbrushes, not just for yourself, but your entire family. That includes mouthwash and shampoo. So, you know, these are little things, but little things can add up, especially when you are looking at supporting a family of 5, 6, 8 people under one roof. You know, items, personal items can be used quite quickly. So feel free to call us. We'd be more than happy to help support you in getting a kit. They're always refillable, so we have a supply of that to offer our community. Next slide. We also provide medical services, our behavioral health department. We provide social services, AOTA programs, as well as domestic violence and sexual assault advising and treatment and sessions. And so just because of COVID and the situations that we currently are under, we are still open and we still provide services, both medical, dental, our pharmacy, as well as our behavioral health department. So feel free to call, make an appointment. We'd be more than happy to see you, either face-to-face or with this new technology by telehealth. Next slide. So the important thing right now, if you feel ill, if you get fever, a cough, get short of breath, sore throat, headache, fatigue, body aches, nausea, vomiting, diarrhea, loss of smell, loss of taste, call us, 414-383-9526. It will take you through a series of prompts. Call us, talk to us. we have people available to assess and determine the urgency for being tested. So please don't hesitate. We have people standing by to take calls, to assess you, and we provide testing same day. So feel free, call us. It is free. The test is free, so don't worry about paying for this. This is free. Nobody gets charged. Feel free to call us, and we're more than happy to talk to you and help you and your family during this time. Next slide. Just a reminder, wash your hands. Soap, scrub, front hands, back hands, between the fingers, around the fingernails, around the thumb, the wrists. Rinse your hands, dry your hands 20 seconds. Probably the most important thing to get in the habit of doing, this is the cornerstone of public health, is washing your hands, and it will be for the foreseeable future. And everyone should have a song or something, tap your toes, however rhythm you want to be, 20 seconds, to wash your hands as often and as often as you can. Next slide. This is a picture of our team. These are the folks that are on the front line. These are the folks that take the calls. They do the assessments. They do the testing, the screenings. They are out there every day, and I'm very proud of them. They do an excellent job. They're dedicated and committed to supporting this Native community of all walks, and it's important. It's important to me because without these individuals, it would be hard to keep our community safe. And so feel free to call us. We'd be more than happy in your time of need. If you feel like you need to be tested, we'll be doing this. And if you do, you'll be meeting one of these people for sure. So with that, I'll turn it back to Mark, Jeremiah, for any questions that may have come through.
Based on some of the conversation you've had, one of the outstanding questions, and you've already addressed this, but I just want to make sure everyone hears it. We have some relatives where they've said, well, my niece or my nephew shops for me, and they bring the food home. And you address that in the carryout section, where it's not the food itself, but it's the containers that need to be cleaned, washed, and I would assume as best as can be under what you're saying. Is there any kind of different way of going about containers or food containers specifically than certainly hands or wrists that you mentioned? Is there something that we should be using or doing that can be best applied to the containers?
Sure. So my family, my household, whenever we come back from the store, we do wipe items down. So that could be that common household bleach item. That could be that spray bottle of the 4 teaspoons of bleach in a quart of water, and you just use a towel and squirt, and you wipe everything down. You wipe boxes down, you wipe down plastic containers, you can even wipe down the cardboard aspects of food, plastic coverings such as like the bags bread comes in, or fruit that you put your fruit in from the store, or the grapes, the containers. Anything that holds the food should be wiped down at least once and set aside for 10 minutes, and once that's dry, it's good to go.
Just to follow up on that one of the folks that reviewed what was put out at our last session said that they put their what they buy at the store out in their garage. And I forget, I think it was, they said 3 days. Is there any truth to it that the virus doesn't exist after 3 days on their containers? plastic paper, that kind of thing?
Yeah, so the general sense right now, and they've certainly looked at this and evaluated and studied this. The main surfaces that would be of risk would be the hard plastic, smooth surfaces. So 72 hours. That's how long a virus has been documented to last on those types of surfaces. Now, I guess when I buy food, I don't want to wait 72 hours, but I'll do the quick and dirty of using disinfectant. Honestly, I think if you do the disinfectant wipe down of all your food items or any products that you bring in the house, they will be available for immediate use after 10 minutes.
On the subject of cleaning, one of the questions here was, so rinsing after a 10-minute exposure, we're doing that with the bleach solution. If they rinse off, does that just defeat all the work they've done, or is there a prophylactic or a protective carryover of once I've cleaned my hands with the bleach solution that gets me through a certain amount of time? Or do I do this as often as I can every time I'm exposed to something I don't know or haven't cleaned?
So yes and yes. So whenever there is a hand exposure to anything, unfortunately right now, it's almost, hey, wash your hands. Even if you are using a bleaching product at home, you can clean the surfaces. You can clean a surface beforehand to place your items on, take an item, clean it, put it on the dry area, and go to the next one and do the same thing. It's almost like a production line. So once you're done, you will need to wash your hands after. You need to wash it beforehand and after. And certainly after, because you don't want to touch anything that may expose you. So again, that hand washing routine becomes pretty important when there's a direct contact with your hand, even at home.
One of the questions that we have from our community members is going in a different direction, and I think is very indicative of what we're seeing as just common people out here, watching all of the news feeds, seeing all of the reports, some responsible sites, some not. I'll just read it directly and try and give a view of it. Here we go. Quote, there has been news about a strange coronavirus possibly reinfecting children with different systems. Is this a mutation of COVID-19? What is happening? And maybe if you could explain a little bit about what a virus is and how it functions might help answer this, just in a basic layman's term approach.
So the virus, think of the virus, think of the common cold, think of the flu, influenza, the flu. Those are viruses. Coronavirus is very similar to that. It's made up of nucleic acids, RNA, to be more specific. Bacteria infections obviously come from a different organism, and that comes from bacteria. Antibiotics take care of bacteria. There are some antiviral medications that help with viruses. There's nothing that helps treat right now that we know of absolute about coronavirus. The question about whether or not coronavirus can reinfect children, and affects them with different systems. Now, I know that in the news right now, there's obviously concern about young kids who are developing something called Kawasaki's disease. And Kawasaki's disease is an inflammatory response to, I think in this case, because it has so much attention, is an inflammatory response to the virus. And so kids get the virus and their immune system sees it as being different and attacks, and they start attacking not only the virus, but they attack their bodies themselves. And so as a result, a lot of different things start showing that are very odd, that aren't normal or typical of what we're seeing in the COVID typical symptoms, the fever, the cough, sore throat, those type of typical flu-like illnesses. These are they're different symptoms, and it could be rashes, it could be a tongue, it could be the lips, it could be blotchy rashes, or a young kid just not looking well, high temps, fever, not only fevers but low blood pressure as well. So it gives off a very very different pattern of symptoms. And what we hear about this in Kawasaki's, now this is not a reinfection, it is the body's response to the infection. And I think everyone needs to keep in mind that Kawasaki's is a very rare occurrence. It does not happen very often, and more than likely it's due from some type of something that causes an infection. And that could sometimes be bacteria, could be fungal, could be parasite, but more than likely it is due to a virus. So Kawasaki's, you hear it in the news, it is not a new problem, new disease. It's been present for a very long time, and I think because of what's occurring, we get much more direct exposure when we hear about diseases we haven't seen in a long while. So I hope that tries to answer that.
I think so. It does, and I do understand it. A lot of us know that that's simply the mutation part seems to be intimidating for a lot of folks, and thinking, just understanding that when it comes to a virus, that's just what it does. In a part of its life, it doesn't do it automatically, but it just happens. It's life. There's mutations that happen, and certainly hundreds of thousands of them throughout the world happening every day. But that kind of gets conflated with the other things too, so understandable. Our next question is, should someone get tested if they're not showing any symptoms? Understanding some background for that question, there's a lot of fear within our communities because there are folks coming back to work. We know that the safe at home order being lifted, a lot of bars, a lot of people socializing, and however they socialize, like the politicization of COVID-19 means that somehow if a state is lifted from stay at home, we're all safer. We're hearing that things have flatlined and we're all safer. Folks are working with other folks that are functioning in worlds that they don't function in, but then here they meet at work. So is someone not showing any signs at all, concerns about perhaps being asymptomatic or just wanting to get tested? Should they get tested at this time?
So that's you can go about that in two approaches. So what we know now, and so obviously having the ability to test, the capacity to test, and if someone does come up positive, doing the contact tracing, or basically investigating that individual and why they became positive. So I think it's pretty safe to assume that if an individual does become positive, they live in a household of either 3, 4, 5, 6 people, there's a strong possibility that each one of those individuals may get the virus. Now, just because they reside in the same house doesn't necessarily mean they're going to get it, and they could run around being completely asymptomatic. A few days ago, before the Wisconsin Supreme Court made its overruling, the Wisconsin DHS gave out a recommendation to, when it comes to contact tracing, is for not just the original person who got tested being positive, but the individual that this person may be in direct exposure with. So if that means in the house, even if those people are asymptomatic, it is generally speaking okay to test those individuals that may have symptoms or they don't have symptoms to get tested. Now, I know people will be going back to work. They'll probably feel fine and certainly want some reassurance. There are places that are actually doing testing for people that have no symptoms. And they are lightening those restrictions to not just being sick, but now concern that you may have been exposed, but don't have any symptoms to be tested. We certainly provide that at our location. So it is conceivable that people with no symptoms can get tested, and they should. When, going back to the workplace, if there was one thing I would ask people to do is to assure that their employer is providing them the best protection possible. So if that means screening individuals before they come in with either temperature or some kind of checkoff of signs or symptoms, that would catch a good portion of individuals who may have it. But I think the first sign, there's also an individual responsibility of first signs as well. So if you feel sick, have a fever, a cough, don't go to work. I know you may want to, and you may have to, but if you're sick, even with mild symptoms, you may very well be an individual that transmit this virus in the workplace. So they should get tested. Family members of exposure should get tested, even if they don't have symptoms.
I think that was a great question, because if understanding that the COVID-19 virus for incubation is about 5.5 days at the quickest, and kind of several days afterwards more common. We're looking at dates of May 19th. So as people report back to work, May 19th might see some exponential growth. Certainly by May 26th, there might be some cases. Just mathematically, folks are going to be concerned. So what I've heard you say kind of going forward is, if we knowingly have been exposed, but not showing symptoms, that we should start that really good thought about coming in to be tested.
Correct.
And that's that moment when we do it. I do have a question that's Indian country related, the next couple, one from me and one on the screen here, but this is a very good one. And the quote is, simply looking at from a medical public health perspective and not politicizing, how are the efforts of the Cheyenne River Sioux tribe and Oglala people, Pine Ridge, in setting up checkpoints at the borders of their land, beneficial? I think what the person is asking here is, do borders make a difference for this virus?
Yeah, so, we all know that each tribe is its own sovereign nation and can certainly make up their own rules and policy and their own governance, administrative, legislative policies that best suits and tend to their respective tribal members. In this case, in Cheyenne River, Pine Ridge checkpoints, if the chairperson certainly designates that this virus is a threat to the tribal members and wishes to establish checkpoints, I feel they should certainly be able to do that. Now, that's from a tribal point of view. From a medical public health view, just as you alluded to, Mark, there may be individuals, and there is a delay in terms of exposure to actually signs or symptoms. And it can be as quick as 72 hours to as long as 14 days. So if there are going to be checkpoints, it almost has to go both ways. Restriction from going out and restriction from coming in, if you're being absolute about it. And the reason why I say from going out is because individuals that may go and leave the reservation, they may go to work. Their workplace may have it. They don't know it, they have it, they are exposed to it, they go back home. And so going back home with a delay of 72 hours to 14 days, as a tribal member, bringing it from outside back to the reservation, there's a true risk of not only transmission, but of this occurring regardless of checkpoint. So it can go both ways. I understand it, but from a public health approach, if you're going to be absolute, you may have to restrict going, leaving, and going.
We did have another question come in. Is the Gerald L. Ignace Clinic specifically offering antibody testing for anyone who thinks they may have had the virus?
So we do offer. We have a private lab through Quest. If that is something that is desired, if they certainly an individual suspects that they may have been exposed, had it and recovered, people can get a blood draw test. We don't have the finger one, but we have the blood draw, and it gets sent out. We don't do the test on site. We send it out through Quest, and they do it. It takes about 72 hours plus for that result to come back.
We do have about 15 minutes remaining in our time together. And with that, there's some questions that have happened offline in between our sessions. One is there's some concern that healthcare professionals are falsifying information, that the numbers are either being undercounted or overcounted. From your perspective and what you're seeing on a day-to-day basis, I think just privately we had a conversation that you're up to anywhere between 25 and 35 folks a day you're seeing. What are your thoughts about that when just the person who's just watching this and concerned for their family? Am I hearing the truth when the CDC or the government speaks in whatever kind of clothes that person or position might be wearing?
Sure. So, I can understand the skepticism that may come about with test results. And I think I don't feel that it is a direct intention to underreport or overreport. I think what it really comes down to is the proficiency at which tests are being done through the swab and the results that actually come from that. Now, the reason why I say that is because all of the tests that are out there, all the nasal swabs, all the oral swabs, all the testing, this gets a little technical, but it's something called sensitivity and specificity to a test. That means that the sensitivity that if I do a test, that at what rate will it be a true positive? The specificity would be, if I do this test, what is the true negative? That means that it truly is negative. And there is no 100% test. So when we do a test, a result comes out as a result of that test. There may be some false positives, or there may be some false negatives. And so when a number comes out, whether being tested being negative, tested being positive, I take that number as being true. But it's not because for a lack of counting. It may be because of the test itself and the sensitivity and the specificity of the test being actually done and done well, and being able to give you at least 95% accuracy that the test that is resulted is truly the result of that test. That's where the discrepancy may come in, not because of fudging numbers or undercounting or overcounting. It actually comes down to the test, the swab, and the reagents that are being used.
In this house, we call it the Ryan Braun syndrome from the Milwaukee Brewers, and it was when he was being tested and chain of custody and all that other stuff.
Oh yeah.
There's so many places where it can go right, and so many other places it can go wrong. One quite serious question came my way the other night as the order was lifted in a late email. And that was, and it was just two folks that came to me personally and said that they were working in a place, and I don't know if it's the same one, it may be, one of them has a part-time job. Their employer is telling them as employees that they shouldn't wear protective equipment, that gloves, masks, that kind of stuff, it's going to create a lack of confidence in their customers. It's a forward-facing sort of situation, and they want people to know that their business is clean, they're doing everything right, they trust their employees that they're doing the right things, and they want people to feel good about coming in the restaurant without seeing all that stuff, the fear stuff that's happening outside. I get it. It's a concern for their jobs, and what is their response? I'm not looking for you to get into a labor situation, but I guess I'm asking if a supervisor comes to someone in our community and says, there's no need for you to wear protective equipment, what can that person do, or what maybe is a better way to take that conversation?
Yeah, so just because the order has been overturned doesn't absolve the general public from following what currently has been in place. So, and what I mean by that, the Safer at Home basically tells everyone, for all of us, to stay home and only essential workers go out, blah, blah, blah. With that being lifted, it doesn't absolve us from having to protect not only ourselves, but also the communities that we reside in, or the businesses we may go into. So, you know, wearing a mask in public, that just because of the order was rescinded doesn't mean that that's still not in place. That is still in place, just like washing hands are in place, and sanitizer, social distancing, all of that is still in effect. So just because the order has been lifted doesn't absolve us from not only our personal accountability, but also from a public health standpoint. People can still continue to wear their masks and wear their their face coverings in the general public. And so I wouldn't be afraid if it comes down to it. It is not a bad thing for an individual to ask their employer about what they are going to do to help protect them in the workplace. That is an honest question, and I think it's and you should get an honest answer from your employer.
A follow-up to that one, when we're looking at the numbers, very often our community is saying, well, it's not really affecting that many people. On the other side of that, some of the early modeling suggested that 30 to 60% of our American population, dominant culture, trying to bring in just an overall mile high view, will eventually be affected, infected, certainly more than that, exposed. What is there any kind of current reassessment on those numbers? That's a very broad number, meaning 30 to 60% of the American population will have been exposed and possibly carry the virus.
So, so I'm getting, the question is about where is this going?
Right. So what's happening out there is folks are saying this doesn't affect me. Mm-hmm. This only affects elderly. This only affects people with that have vulnerable health issues. That isn't me, and I'm not getting it because I know who the people are that are around me. Mm-hmm. I'm fine. So the question is kind of looking down that road and trying to counter that with some sort of informative discussion and saying we may be at 1% now, but that percentage will grow. Mm-hmm. And if you're going to roll the dice with your health, you're rolling it with mine, our customers, our family. It's easy to say that, but a lot of people are just want to stick to this fact driven, that 0.5 or 1% of us have been affected. So if you might kind of speak to how do we answer that when kind of confronted, and especially now at work with these diverse opinions about what this disease, what this virus means for our nation and our world.
Yeah. So, you know, when COVID first started coming out, what we heard and highlighted with such great intensity was the number of cases, and then it was the impact of the number of deaths associated with the COVID, and it became such a focal point of intense, you know, viewing. I think what may be getting lost, and it's hard to pull back from that such, you know, in your face concern of how much this was impacting, is from very early on we knew that this was infecting older individuals, but it wasn't just older individuals for the sake of being older. It was because they also had underlying medical conditions as well. So we saw huge impacts on nursing homes and long-term care facilities where we knew there were higher numbers of our elders and higher numbers of elders with chronic conditions who just didn't have the immune or the physical reserve to manage through a COVID-like illness. But what we're seeing now is there's a diversion, a reshifting of, we know that population is certainly at the high risk. And what we're seeing that was kind of that initial huge wave that came through. This next wave is more of kind of a redistributing of virus and who's actually getting it. And it doesn't matter who you are, whether you're 64 or whether you're 64 days. If there's a chance that you could get it, you can get it. It doesn't matter. And so now we're starting to see a redistribution of age groups, and both men, women get it. Doesn't matter which age group you're getting. But I will say the impact is not as significant as it was before. And the reason being is the younger population, and I mean younger, less than 65, that younger population who have fewer health problems or fewer chronic care conditions, who have the physical and the ability to overcome this, what we're seeing is that different shift. And so there's a higher number of people getting it. There are cases every day, but these are the people that are not chronically ill who end up in the hospital. That first wave of older folks or elders who got sick and may have succumbed to this. Now we're seeing a different wave of just the general population as a whole, but they're not getting as sick and they're staying at home. And so, so when we look at this virus, yes, it can harm you, without a doubt. It can harm you. And I think how this needs to be looked at moving forward is really stratifying who's at risk, who's really at high risk, and just general risk as a whole. I think that's where that fine line of what needs to be done for, you know, high risk versus your average general person in the community. That's where that approach, there's going to be a higher level of protection and prevention for that higher risk group, regardless, moving forward, regardless, every day for the next 9-12 months until there's a vaccine. That high risk group will need to be protected and prevented from infection.
We're beginning to close our time out with just a few moments remaining. I was wondering if you could close us out from your perspective as treating people, not just around the COVID-19 issue, but there are daily health concerns and issues that are in front of all of us. And if there's any perspectives or words of enthusiastic encouragement around the challenges, or even if you can mind some of the work as you're confronted by it in saying, hey, this is what we need to be aware of, and this is why why essentially we're doing this program, because the problem isn't going away just because the COVID-19 has been politicized. We're still at it, and the cases are growing. That's as much as a layperson such as myself can say, but I think you can speak to that a lot better as a physician. And I'll end my questions there.
So, you know, even before this, before the pandemic of the COVID-19, Native people as a whole certainly had our health issues, our health disparities, well documented, well known, and it didn't matter what community you were in. You know, whether it be diabetes, kidney problems, liver problems, lung problems, you know, Natives throughout the country, and talking specifically to the Natives here in Milwaukee. You know, we had our health issues before this, and now this is here that just compounds them. However, this infection, this COVID-19, there are ways to protect yourself. As was mentioned during this session, our clinic is certainly here to help you achieve that, not only for yourself, but also for your family. It is a challenging time, without a doubt. It is challenging. Before COVID, it was challenging. It's even more challenging. But I want the community to know that you have an extended family here at our agency. We're here to help. We're here to help treat. We're here to help you manage, whether it be medical, behavioral health, whether it be social, whether it be even helping out for even personal items or cleaning items for your own house. We're certainly here to help, and we want you to be safe. We're not going anywhere. You know, we'll be here for a very long time with the strict intent of improving the health, not only before this, but also during it and after this practice. And so, just so the community knows, the GLIC is here to help improve the health and wellness of Native people in Wisconsin.
So in closing out this session, when we look at the numbers, we have about 14 participants online. Please, those of you that are on this program right now, understand that you are socially connected. You have the gift of being hooked up to Wi-Fi and the ability with electronics to see this program. A lot of our community does not have that same advantage, and they're looking to you for leadership. If there are ways that you can spread the word about this program, but especially spread the word about what you've responsibly heard and can relate to our relatives that are out there and don't have the gifts as we do to enter into this call, please start spreading the word, start putting to rest a lot of these rumors here, because when people aren't socially connected or have the ability to see responsible news, it's like a game of telephone. Things start getting worse, things start getting bleaker. Mental health problems certainly are all over the place, and we need to be paying attention to those things. If you would like to see other subjects in specific to this issue of COVID-19 and Native response, Native issues that we confront, please continue to ask questions and bring those to us, and we will be here again next Thursday at 3 p.m. And that's from me. Thank you for being a part of this, and I'll let Dr. Ignace have the last word.
Thank you, Mark. Thank you for not only being a supporter, but an advocate for, during this time for Natives across Milwaukee and throughout the region. There's only one message here, and it really is about protecting yourself and your family, especially during this time. I always tell people as I depart is keep washing your hands. Don't touch your eyes, nose, or mouth. Those are the two most important things that you could do every day and as a reminder to not only yourself, but to your family members. Those are the two things that will definitely help protect you. With that, I enjoy these sessions and, being able to answer questions from the community. Some of them are pretty tough. They're not easy ones, but that's okay. I'm willing to help and assist in the best way I can, in the manner I can. And I think it's going to be important that our Native community stays connected, they stay informed, and look at prevention and protection as best we can through this time. And so with a lasting message is for everyone to stay Native strong.